Hello, today we're going to teach you about cancer and we're going to go through a documented scenario. We're going to follow the experience of Leah through her diagnosis and treatment of cancer. We'll begin with her first doctor's visit and after she noticed several changes in her body. Cancer is a disease of the cells that can occur anywhere in the body. Normal cells grow, divide, die, and are replaced. In all types of cancer, cells continue to grow and divide but never undergo cell death. This causes older damaged cells to continue to divide, leading to accumulation or tumor. Cancerous cells can break off a tumor and migrate within the bloodstream and affect other areas of the body and can cause the cancer to spread.
Hello.
Hi.
Welcome. What can I help you with today?
Hi, so I'm coming in because I've recently had some changes in my body. I've been having a lot of trouble going to the restroom, and when I'm seeing some blood and I'm having a lot of trouble urinating. I'm feeling a lot of pain in my stomach, and I recently got a sore finger and it hasn't been able to heal as fast as it normally would, so I'm getting a little worried.
Okay, so you said when you went to the bathroom you noticed any blood?
Yeah, from time to time, not every time, but I have seen.
Okay.
Cancer can present itself in many different ways, as a number that Leah has already mentioned, as well as breast size changes, a lump, or thickening on or under the skin, a cough that won't go away, weight gain or loss with no reason, abdominal pain, and unexplained night sweats, as well as unusual bleeding or discharge. There are a variety of cancers, and many of them are presented in different ways.
Okay, so I want to do a family history, and then I'm going to perform a physical with you. So can you first tell me a little bit about your parents?
So my mom and dad are both still alive. My mom has recently been diagnosed with high cholesterol. And do you need to know about my mom's parents?
Yes, that would be great.
Okay, so my mom's mom died recently of natural causes, but her dad died of colon cancer, so that's why I'm a little worried because cancer runs in the family.
Okay.
And then my dad has been recently diagnosed with high blood pressure. My grandparent from my dad, his dad died of a heart attack, and the mom died of kidney failure.
Okay, and do you have any siblings?
One younger brother.
And he's
perfectly
in
healthy.
Okay.
Yeah.
And are you married? Do you have any children?
I am married and I have 2 children.
Okay.
It is important to factor in the influences of genetics in the development of cancer. Knowing that Leah's grandfather had colon cancer, the PCP should also keep the possibility of cancer in mind. Family histories can go deeper through the aunts, uncles, and cousins. Along with family history, we can obtain a personal history of Leah. That could include other factors leading to cancer, like smoking, viruses, chronic inflammation, chemical carcinogens, radiation, diet, obesity, alcoholism.
Okay, so we need to see what is causing these issues. So I'm going to be palpating your abdominal region, and I'm going to get a better idea of where the pain is coming from, and then we can perform some imaging tests as well as get some blood work done.
Okay.
So now I'm going to have you follow me into the exam room. Okay, so if you could just take a seat right over there, that would be great.
Okay. You want me to take off my coat?
Yes, that would be perfect. And my intern is going to be joining us, if that's okay with you.
Yeah, that's good.
Okay. So first I'm going to be taking your radial pulse.
Okay.
And when you're talking about your abdominal pain, is it like consistently like?
Yeah, it has become really often and it's getting worse.
Okay. And now I'm going to be taking your blood pressure. Okay, and can I have you lie down for me? And is it okay if I just
Yeah.
lightly? Okay. And any pain anywhere?
Just over here.
Just over there?
In the next scene, we're going to be showing Leah going into her radiologist appointment, and in that, she's going to be doing a PET scan, and a PET scan is a positron emission tomography, which means that they use a radiographic substance called a tracer, and a tracer is a sugary substance that is called an FDG, and that it accumulates and highlights different parts of the body that uses a lot of energy, and it gives off gamma rays, and gamma rays are then scanned and the computer converts it into images that show how the tissues and organs are working.
Hi, Leah. I'm going to be performing your PET scan today.
Nice. Great.
So with your PET scan, I'm going to insert a small needle into a vein in your arm, okay? And it's going to inject a substance in there so that we can view the image. Now, it's very important that you try to stay as calm and relaxed as possible. Kind of takes a long time, so we're going to have you be still for about 90 minutes.
Okay.
So hopefully you can handle that. And at this time, we'll move you into the scanner room once that's completed. And then once we're in that room, it's going to take another about 30 minutes. So we're going to have to ask you to be still, try not to talk, just for the accuracy of the results. And we only have to do this one time.
Okay.
Good. Do you have any questions?
No, I'm good, thank you.
All right, perfect. Well, let's get you started, okay?
All right, thank you.
Alright, since we've already talked about some imaging modalities and an extensive medical history, we are now going to be talking about a biopsy, which is another diagnosis tool. And a biopsy is when the surgeon removes some tissues or a whole lump of tissues from the patient, and a pathologist comes and looks at the tissue under a microscope to see and check about abnormalities and how the tissue looks.
Okay, so we have gotten your PET scan and the biopsy back. Unfortunately, the test showed that you have a diagnosis of cancer. I know that this can be scary, but we can talk about options for management and for treatment. So I have talked with an oncologist, and I want you to go to him, and we are gonna think about either surgery, or chemotherapy for the beginning, and then we're gonna see where that takes us. So isn't that okay?
Yeah.
Okay.
So Leah is given two common cancer treatments. They include surgery and chemotherapy. And surgery is when they remove the tumor, and chemotherapy is a drug therapy that targets all cells, and then they destroy them. There are different types of chemotherapy, and they are grouped together on how they work and their chemical structure and the relationship with other drugs. And other treatments are the external radiation, which is where the patient goes to an outpatient setting 5 times per week, 1 to 10 weeks, and it depends on factors like the size of the cancer and how healthy the patient is. And in the next scene, Leah is now post-surgery and is going to check in with her doctor to see how she feels.
Hi Leah, so how are you feeling today?
I'm feeling very tired and weak, but I've heard that that's normal for the chemo, and I've had a lot of short-term memory loss. But in support group, they've told me also that that's normal due to the chemo. But they told me my surgery was successful, so they almost took all of the cancer away, and I'm very happy to hear that. And I'm just gonna continue doing chemo just to hopefully go into remission after that.
Okay, so I'm really happy about that I'm surgery. I'm very, very happy for you. Now that your surgery is done and your incision has healed, that effort from your oncologist, I am gonna have you start physical therapy, and I'm gonna have you start for 3 times a week for maybe 5 weeks right now, just to kind of see how you can, how you're doing. And I'm gonna have you do this just because I want to make sure that once you're all set with your chemo treatment, that then you're still able to do the physical things that you were able to do pre. surgery and chemotherapy.
Great. Sounds like a plan.
Hey,
Hi.
how you doing?
Good.
All right. So I know that you just went through a little bit of a warm up. Welcome to PT, by the way. The purpose of PT is going to keep you nice and strong, nice and limber. We're going to keep a little bit of new exercise going. So we're going to go with the lower body, a little bit of ab work, and a little bit of upper body too. Okay.
Okay.
We're going to start with the lower body.
Okay.
So we're going to use this yoga ball. We're going to do a yoga ball squat.
Okay.
You put this right between you and the wall. Put in the small of your back. Keep that chest up. Sit back. Go down nice and slow. Bend your knees. And bring yourself back up nice and slow, all right?
Okay.
We're going to go ahead and do 10 of those.
Okay.
All right?
So right here.
Keep that chest up. Move forward. Awesome. And bring yourself. We have these small 3-pound weights. These would be great for keeping your shoulders nice and mobile. We're going to do a nice abduction, raising those arms up, keep those chests out. Remember to take it nice and slow.
Okay.
If you feel like this weight is too heavy, please go ahead and tell me.
Okay.
Okay. Good.
Okay.
Keep that chest out. Bring it up and down. All right, we're going to go ahead and 10, 2. Last one, we're going to work on our core. So we're going to work on a glute bridge, okay?
Okay.
You could just follow me over here to this seat. Go ahead.
I got.
Yep, right on. For a glute bridge, you want to just lay all the way back. You're just going to raise your hips up. Squeeze your,
that?
perfect.
Okay.
And back down, nice and controlled. Just go ahead and sit up. Just sit where you are. I'm going to grab a cold pack for you, so we're going to go relax those muscles that you just worked out on, and we're going to get you going and get you relaxed and getting home, all right? That sounds good?
Thank you so much.
Thank you.
Hi Leah, so you are officially in remission and you are like all set like with your treatment. So do you have any last questions?
I do. Is there any long-term effects that I should be watching out for?
Yes, there actually are a few long-term ones just because of the techniques that we had like used for your cancer treatment. So I can give you a pamphlet right now, and these are some of the side effects.
So the long-term effects of cancer are due to radiation and chemotherapy treatments, and these include osteoporosis, fatigue, dental problems, diabetes, neuropathy, organ damage, and many more. Thank you for watching our video, and I hope you learned something about cancer.